Healthology its slogan is where science, practice, and social interests meet. Those words were carefully chosen because we do want to focus on the science. We do want to focus on the practice in terms of changing health, and we want it to be social. Social for fun, but social in the context of being concerned about social need and social care for people. I think that slogan captures it.
I think Healthology is actually, it's really an old story that is finally coming full circle. It's finally showing up in the realms of maybe the information and maybe just passion about it. And maybe the current state of healthcare is finally reaching a point where in our country and globally we've decided it's time to think about an ounce of prevention. And so for me, that is the most exciting part about it, is this idea that you're bringing all walks of life, all disciplines, and trying to truly find ways to leverage that into action.
The speed at which we've gone from a focus on sick care to health care to health at the community level, that spectrum over the past 10 or 15 years has really picked up, and it's picked up globally. It's really exciting to see.
So what I bring to Healthology, I think, is the experience of working at the intersection of health care, public health, and the social determinants of health, and the ability from that experience to bear witness to what I think this moment represents and what Healthology has kind of been able to accomplish, which is making people realize that the ability to move upstream to address social determinants, health, and health care is not only necessary, but it's possible.
More and more payers across the country are realizing that we're in a really skewed scenario. Collectively, we have decided as a country that we will spend less on social services compared to healthcare, right? And that makes us an anomaly compared to our peer countries, where they spend the exact opposite. And there's no surprise, therefore, that you have a doctor talking to you about how to move upstream. It's because that's where it's coming, folks. It's coming to us downstream because we haven't invested upstream yet. And so for that reason, a lot of payers who are now seeing this cost of this are saying, well, wait, as we move towards value, away from volume, we need to look at drivers of value, and one of those drivers of value is social determinants.
If there's a handful of people, it's that they found one person that is in the trenches with them, one advocate, one person that kind of gets it and empowers them to kind of maybe have a buddy or someone they can reach out across a different state. It's one of the greatest things.
When I think about what people can take from this event, it's that sense of momentum, that sense of ability to make change. Momentum doesn't happen in a linear way, right? It's not like today will lead to some action directly tomorrow. But momentum comes from taking the ideas, the conversations, the connections that today brought, and then making sure that those ideas leads to something, some action. And that's a reflection really of what Healthology was able to accomplish here. You've created a conversation that is not just a professional conference, but a kind of a dinner table feeling. It's been personally fun just to be part of these conversations.